All right, well, hey everybody, this is Sandy and welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. So guys, today I'm so excited because I have an interview with Dr. Jessica Hasson, and I hope I pronounced her name right and she's going to tell us in just a moment. But she's a clinical psychologist, and while I'm at it, I want to give a quick shout out to one of the participants in the Sandy's DIY Health Advocacy Facebook group, and that is Dr. Graham Dursley. He is a dentist in, I believe it's Maryland or Virginia. And anyway, he's a very helpful and very valued participant in the Facebook group. And he suggested this topic and he introduced me to Dr. Hasson. So I'm going to turn it over to her to more properly introduce herself and tell us a little bit about her background.
Hi, everyone. So my name is Dr. Jessica Hasson. I'm a licensed psychologist in the DC metro area. I'm also a certified telehealth provider in Florida now. So I have a PhD in clinical psychology, and I'm an assessment psychologist. So I work a lot with individuals that are looking for consultation or to know if they or their family members meet criteria for a diagnosis, things like that. I also consult with other mental health and medical professionals, and I also consult with both the criminal justice and the juvenile justice system in the state of Maryland.
Well, that sounds like a full plate. Well, thank you and welcome to my channel. So I thought I would just start very broad and then maybe we could narrow down. And I was just hoping that maybe we could get a sort of a bird's eye view of just what you've seen in the last couple of years, like pandemic wise.
So, I mean, that's a loaded question. There's been a lot, and it really seems to depend person to person. Everybody's experience with this has been very, very different. So the whole platitude that we had at the beginning, like we're all in this together, the fact is we weren't all in this together. Everybody had different experiences. We had some people who were able to quickly pivot to work from home and were able to be there while their children were remote schooling. We had other people who had never stopped working and had to continue to go in. We had healthcare workers who would go work and then would live in a tent in their backyard to make sure that they wouldn't expose their children or their family or their loved ones to anything. So it's been a lot of everyone needing to determine their own way through the pandemic. And when you're trying to do a joint pandemic response, it can lead to a lot of anxiety, anger, frustration, and things like that, because no two people are navigating this the same way. And there's not really a right way to navigate the pandemic. And that's really a lot of what I've been seeing.
Yeah, thank you. That's actually a really good segue into another question I have, which is that it has to do with caution and care versus fear and anxiety. And just from not so much my YouTube channel, but the Facebook group, which is more interactive, I've sort of come to see that as a continuum. And that's kind of what you're saying, like different sort of households and different people require different degrees of caution. And, have you seen this as a continuum, and how does one know which end they're on?
Yeah, it's definitely a continuum. So we've always known that anxiety is a continuum, and it can get to a point that it starts interfering with life. In the extreme cases, it's things like agoraphobia, where you fear leaving your house. We see obsessive compulsive symptoms where people are, spending hours per day washing hands or cleaning or taking multiple showers per day. So we're definitely seeing it on a continuum. One thing that's happening a lot is that we're in a shared trauma. The pandemic is really a chronic period of a sustained trauma. And what happens is we develop ways to cope during the trauma. And as the pandemic changes, we need to change our coping strategies, and that always doesn't happen. So what happens is some people will stick with the coping strategies that we used in March 2020, when we didn't know what was happening. And back then, I mean, it wasn't uncommon for people to leave packages in their garage and let it sit for a week or two. Lysol down packages. Some people were even like Cloroxing food at that point as well, because we didn't know how it was transmitted. We didn't know anything about it. And some people are still doing that because of the anxiety of what if this variant is now is transferred via fomites, and what if. So we're seeing a lot of that what if anxiety, and we're seeing what was adaptive in March of 2020 and is no longer adaptive, and has become really impairing for some individuals' lives. And that's when it hits more of the less of the caution and really more into anxiety.
Yeah, and now that you said that, I can see some place where the opposite is true. Like I talk a lot about masks on my channel, and masks are sort of the opposite. And remember when they told us, well, this is not airborne and maybe it's just respiratory droplets. And then it was for sure just respiratory droplets. And now, and it might be partly the variant, not so much, that this was the case and we've learned better, but now they're saying much more highly aerosolized, and therefore respirators might be a better option than most masks. The same people who are going to be more cautious, like you say, or more obsessive, I think that can be very anxiety provoking as well. Would you agree with that?
Yeah, I do think the pandemic itself and the response has been extremely anxiety provoking, because it's been really 2 years of uncertainty. We don't really know what's coming at us next, and you're constantly on edge, and it's anxiety provoking. And on the other hand, you have individuals that are just kind of done. They're burnt out with it. They just don't want to do anything. So when you have individuals who are feeling anxious about it, or have autoimmune conditions, or are immunosuppressed and really concerned about it, or have seen it. And so a lot of my friends who work in emergency departments or in ICU wards, they tend to be a little bit more cautious because they've seen sort of the worst case scenario.
Mm-hmm.
And then on the other hand, you have individuals that haven't been as impacted, or the people that they know who have had COVID have had either asymptomatic cases, mild cases. They don't know anyone who's passed away from it. They don't know anybody who's been on a ventilator because of it. And they see it more as like a flu or a cold, and not necessarily understanding the extremes. And so you get that mix of individuals, and there's a lot of, again, tension between the two groups, and between a lot of people, frankly, because no one, like I said, no one's had the same experience. And because no one's had the same experience, no one has the same viewpoint on how it should be handled. And we're not really getting a clear answer on how we need to handle this. Because like you said, there's been a lot of back and forth. The masks is a great example. At the beginning, we were told don't wear masks because the healthcare providers needed them. And then it was cloth masks are okay. And now it's everybody really should be wearing an N95. It can be very frustrating for somebody who's wondering, why don't we know what we're dealing with 2 years into it? And that can cause some people to really just give up on, stop trusting some of the guidance that we've been getting.
Yeah. Yeah. And likewise, I think some of the guidance has been so, like in certain areas, is so steadfast, like this is what you do. And as you just stated so eloquently, different people need to do different things based on their circumstances. So it's very, that really ignores people on either end of, what might be the line you're drawing. So what about people like with underlying conditions, or families who have a single member in the household with something like that? Maybe people who there's somebody who can't be vaccinated. Do you want to comment on how might things be for people like that?
Yeah, and I think that a lot of people around me, I work with a lot of families, and it's the under fives that can't be vaccinated, or there's individuals who, because of immunosuppression, autoimmune conditions, they're not developing the antibodies. So I've seen both of those groups, and I've always encouraged the families to consider the risk, and to look at not only the risk to the family member, but looking at the risk of other family members too, and considering mental health as an impact as well. So small children really do need social interactions, and they really do need to play, and they need to do other things. They need to see other kids, run around, play in dirt, things like that. Remembering that it's not just about zero COVID. It's about everything else that gets impacted as well. And each family needs to make the decision that's going to be right for their family. And some of that may be, if you have a family member that's immunosuppressed, maybe the family's testing a little bit more often, or being a little bit more cautious in the household, trying to work from home a little bit, and trying to mitigate the risk as well as they can, while still making sure that you're not causing significant mental health impacts, or even significant medical impacts to other family members. I've heard a lot from individuals who aren't doing what's traditional primary care. yearly cancer screenings or even seeing their primary care physician because they're afraid of being exposed and bringing it back to a family member. And that can yield other problems as well. Something that could have been caught, like a cancer that could have been caught at stage 1 or stage 2, may not get caught until stage 3 or stage 4, where it becomes more difficult to treat now.
Another question I have for you stems from an observation that I've made that, and it actually partly in myself too, that long haul COVID, it seems to be sort of one of the drivers of people's fears of COVID at all. Like some people say, I wouldn't mind getting, if it was just going to be the infection and the acute course of the infection, it wouldn't concern me. But my question is, what about long haul? Because it doesn't seem to correlate with the severity of the acute infection. What do you have to say to people in that position?
Yeah, and that's a tough one. So my background is clinical psychology. My understanding of long haul is what I've heard from my friends who are in medical professions, but also some of the literature on some of the cognitive impacts and things like that. I've heard a lot about people who fear developing long haul. And my understanding is that, we don't know who's going to develop it. And I always relate it back to other conditions where there can be these chronic conditions that happen. So we know chronic Lyme is a thing. I remember back being a kid and my pediatrician telling my parents, because I had recurrent strep infections as a kid, that watch out because we know that kids with recurrent strep can develop OCD. And this is 30 years ago. We now know that it's pandas. So we do know that these viruses, bacteria, et cetera, can yield long-term conditions. We also know that a lot of them can be treated and they're not necessarily permanent. Again, it's a matter of risk and educating yourself and understanding that it could happen, but it also may not happen. And it has to be a balancing act of how much you want to interact and get out and what's important for your health, your physical health and your mental health, and also keeping yourself from having panic attacks and things like that. And again, it's all about finding that balance and figuring out what your risk level is.
Mm-hmm. Yeah, that's a really good point. I'm hoping to interview somebody who works with long haul patients, medical wise, but as you can imagine, they have their hands full right at this moment with the people, especially people coming out of Delta. I think you make a really good point. And one way I've tried to look at it is, I look at the infection rates as sort of the weather report. Like maybe I'm a qualified driver, or if let's say I were a licensed pilot, I wouldn't necessarily go up in my plane when there's a hurricane, but that doesn't mean it's not safe for me to, it's not risk free, but it's still safe for me to fly, when the weather is clear. And I think that instead of having an all or nothing sort of assessment of this, I feel like it makes a lot of sense to be more risk adverse in a setting where there's more viral load and higher infection rates and things like that. And then maybe think about loosening up a little bit when that recedes, because this seems to come in waves. What are your thoughts on, does that make sense?
It does. And it's something I've been recommending to individuals who want to get out there, but aren't sure, but again, are concerned. And I say, like right now where I'm in, it looks like we're coming off of a surge. So knock on wood, the case numbers have been going down. The positivity rate is starting to drop. So it's looking better than it was this time last week.
Right.
At a surge, you don't want to, that's not the time that you want to go out to a restaurant the first time. Definitely, I like what you said about it's a weather report. So look at what's going on in the community. And if there's a lot of COVID cases in the community, a high positivity rate, maybe you do want to pull back your activities a little bit. If the rate's going down, things look better, or you're visiting an area that has a lower rate, maybe push the envelope a little bit more and take some of those steps and see if this is something that you're comfortable with. And your comfort level doesn't have to stay the same the entire time. Mm-hmm. So when the rates are higher, it's normal to kind of pull back your activities versus when the rates are lower. So definitely having that, being comfortable knowing that there's not always one right way to deal with this, that you have to look at everything that's happening, the environment, and your own needs at the time to determine what you feel comfortable doing and what you feel maybe less comfortable doing. I'd absolutely encourage people not only to kind of figure out your own risk tolerance, but to communicate that with other people. Really to be open. So if your friends want to go out to eat and you're not comfortable doing that, just letting them know, like, I would love to see you guys, but I'm not ready to step into a restaurant yet. So can we do something else? Can we meet in the backyard?
Yeah. Yeah.
Or yeah, and just really being open and honest and upfront with people. I think one of the biggest problems with the pandemic response that we've had is really a lack of communication. And I think that the more we communicate with each other and let each other know, like, I'm concerned, here's why I'm concerned, and I still want to see you. This isn't that I don't want to see you. This is that I'm feeling nervous. This is on me. I am feeling nervous. Let's find something that we can do together that is within my comfort zone, or maybe a step out. So I think it's okay to like step out a little bit of your comfort zone, but you don't want to necessarily jump out of your comfort zone all at once. That can be very overwhelming for individuals.
Right. And you don't want to be pushed either. It has to be, yeah, you have to be doing it willingly, or people, I gets the sense, would recoil. And yeah, one thing that we just touched on briefly, but we all live in different geographic locations. This is a huge country, and not only distance wise, but there's kind of different cultures, right? We're so politically polarized that it seems that there's either a strong sense of community or a community that hugely favors rugged independence. And I'm kind of wondering, like, how does this impact people who are like more COVID cautious, or people who are less so? Yeah, what does that do with you, to your sense of community and your trust and whatnot?
Yeah, and I think a big part of going out and interacting with others is your trust level. So I've often referred to COVID as the worst group project known to man. So because it's not just what you do, it's what everybody else does as well. And everybody else has different circumstances. We don't all have the same circumstances. So we all have to do this differently. Depending on certain factors in the area, you don't know if other people around you are vaccinated. So I happen to live in one of the most highly vaccinated counties in the United States. So I can walk out of my house and I'm pretty confident that pretty much everyone I see above the age of 5 is probably vaccinated, and the older ones are probably boosted.
Imagine. I'm sorry, I cannot even imagine that, but okay, sorry.
Yeah, but versus other areas, some of my family members live in other areas of the United States where the vaccination rates are much lower, and people don't necessarily wear masks, aren't necessarily cautious, and things like that. So they're a little bit more cautious outside than I am, for obvious reasons. Up where I am, because we are very highly vaccinated, there's a lot of frustration because we also have a lot of restrictions on us too. And so because of that, there's a pushback on, we're highly vaccinated, all this other stuff. Why can't we do more? Why isn't there more opportunity for things? So I think there's a push pull in both areas. No one's ever going to be completely happy. And it's kind of finding the middle ground. And again, finding your comfort zone as well.
Yeah, that's interesting. I didn't realize that about highly vaccinated places. I can't even imagine what it would be like to want more freedom. So finally, I'm just wondering if you have any tips like that you could break down like into recommendations for people who wish to start engaging a little more in life, but like they've been fearful.
Yeah, absolutely. So I think one of the biggest things is to figure out what your comfort zone is, and you want to take the first small step out of this. So this is a series of small steps. So let's say you want to have a friend over. Maybe start in the backyard. Maybe sit 6 feet apart, but outside, because we know that the virus is less likely to impact you outside. We know, of course, ventilation is a thing. So that's one good way to start. If you want to make the jump to maybe meeting someone at a restaurant or eating out, maybe start at a restaurant that's outdoors or sitting at an outdoor table. And again, you can look at the case numbers. If the case numbers are raging, if there's like a 30% positivity rate where you are, that's probably not the time that you want to like make this jump, because I think that anxiety is going to be there. So looking at what's happening in the community and maybe taking that step out to meet somebody at a restaurant. Or maybe you're not comfortable meeting someone at a restaurant because you tend to be closer together, but you want that experience. So maybe going to a restaurant by yourself and starting there, and then maybe meeting with a friend for coffee. And again, these very small steps that you can do. But again, the easiest thing to do is always to start with something outside, and you can still have masks on outside. So if that's something you feel like that would help, have the mask on. Small steps, baby steps, one step out of your comfort zone at a time. If you've been pretty isolated the past couple of years, you may not want to hop a plane to Puerto Rico for your first like venture out. So I would definitely like small steps first.
All right, well, thank you. Is there anything else you'd like to add that I didn't think of?
Well, a couple of things. One of the things is about social media. So social media can be a wonderful thing, but the problem is it creates an echo chamber. So what happens with social media is the algorithms will show you things that are consistent with what you've been looking at. So if you've been looking at, COVID death rates and high case rates and things like that, that's what the social media is going to show you. And it's going to give the view that that's what's happening everywhere. If on the other hand, you've been looking at, the vaccines don't work and things like that, that's what you're going to get. So what it does is it reinforces our beliefs. So I would really encourage people to look and try to get a broader base and try to understand everything that's going on, because like I said earlier, we're not in this together. Everybody has unique experiences, and really try to talk to other people that are having different experiences from you to get a greater sense of what's been happening in the pandemic and what's been happening to others, and maybe why others are reacting the way that they're reacting. So maybe the person that you see not wearing a mask, maybe they have sensory sensitivities and they can't wear the mask. It really bothers them. Or they recently had COVID and they know that they're in sort of that immune stage right now. I think what happens a lot is that we jump to conclusions about people, and we want to kind of keep from doing that. We want to try to rebuild some of that sense of the community. And some of that is by talking to others and trying to understand their experiences and helping them understand your experience too. And really trying to do this in a non-judgmental way without throwing out any negative terms and things like that.
Yeah, I do really want to thank you. You are just full of like bird's eye view, hindsight wisdom on this.
I appreciate that. It's a lot of it is just like my work and what I do. So I do triage at the clinic. So I'm seeing like 12 to 15 new people a week. And I work with everyone. So some people will come in and they're not vaccinated. Some are, Republicans, Democrats, socialists. We have a few communists, and just essential workers, work from home, and hearing all the stories and just hearing how different everybody has experienced this. And I mean, it's been so beneficial for me to hear everybody's stories.
Almost everything that came out of your mouth is just resonates loudly with me, and I think with my viewers. So I'm going to look forward to seeing the comments and the feedback in the comment section. And I just want to thank you again, and a shout out again to Dr. Dursley for introducing us. And until next time, be well. Bye-bye.